Is scoliosis pain keeping you from what you love? Scoliosis is the development of an unnatural sideways spinal curvature that also twists. And this twist or this rotation occurs into the concavity of the scoliosis. No two scoliosis cases are the same, and no two patients will experience their condition the exact same way. Meaning if two people have exactly the same size curve, say 50 degrees, one patient could be experiencing something completely different than the other patient because it's the way their body adapts and interprets the scoliosis and how it progressed and how their body is adapting is really the response that they're going to have. Now, scoliosis pain is experienced very differently between children and adults, and it's not commonly painful for children, but unfortunately, scoliosis can be commonly painful for adults. Now, scoliosis doesn't become compressive until adulthood. So while children are growing, they normally don't experience any pain. Their spines are experiencing constant elongation because they're growing and their body's very well adapting to the curves. And these adaptations and this lengthening is counteracting any type of compressive forces that could be occurring as the unnatural spinal curvature increases. And as a result of this, patients normally don't experience pain as a result of scoliosis as a child. They may notice very significant postural deviations. They may have very significant curve sizes, but normally they don't experience pain. If they experience pain, normally it's a dull ache at the site of scoliosis, where normally the apex is, but normally it's very mild in nature and tends to resolve itself when patients rest. If kids feel pain as a result of scoliosis, especially night pain, headaches, neurological pain, that's normally a red flag. And if they have scoliosis and they're having some of these symptoms, we normally want to do further investigation to see if there's some other reason why they're developing scoliosis, like some type of neuromuscular condition or some kind of neurological condition that could be associated with scoliosis. However, in adult patients, scoliosis almost always becomes painful. It's normally just a matter of time. Scoliosis becomes compressive in the adult form because as curves are now experiencing the compressive force of gravity, this compressive force of gravity causes these curves to slowly progress. And since the spine is no longer growing and patients bodies can't adapt and grow around the curve anymore, this compression, it can't be adapted to as well, and it causes compression to muscles, nerves, and vulnerable tissues around the spine, which can lead to pain. Pain is by far the number one symptom that brings on a treatment for an adult patient with scoliosis. And in fact, many patients that start experiencing pain and they get an x-ray done, maybe the very first time they know they actually have scoliosis. Their scoliosis may have been undiagnosed as an adolescent and becomes diagnosed in the adult form as a result of pain occurring. Typically, this pain tends to start occurring sometime in young adult life, but it's normally not too bad. I mean, patients can normally deal with it doing conservative things at home, which I'll discuss in a second. But however, as they age and as the curve slowly increases, somewhere around 40, but around 50-ish or so, the pain tends to cause such dysfunction and such problems that what they were doing before no longer has that effect. We say their pain levels kind of change some, and all the things they were doing no longer as effective, and they start experiencing more symptoms. Curve progression in the adult form is not linear. It tends to snowball. It tends to increase as the curve gets bigger and as they get older. The most common pain, it tends to be left low back pain or low back pain, normally affecting down into the legs, most commonly left legs, and that's typically with a low back type of scoliosis. But if they have scoliosis in the upper body, part of the body, they can have shoulder or mid-back pain or pain going down into one arm. Now, the best remedy for scoliosis pain is actually to treat the scoliosis, meaning you can treat the symptoms associated with your scoliosis, meaning you can take medications, you can have injections, you can have all these medical treatments to try to hide what you're feeling, but by far the best way is to treat what's causing it. And the majority of the time to reduce what's causing it, you have to reduce the curve size, meaning make the curve and actually make it smaller, make the curve actually more structurally sound by reducing the structure that's wrong with the scoliosis and reducing how much curve progression has occurred. Working towards curve reduction typically means that you can improve what you're feeling. Traditional physical therapy normally just works on core strength by increasing the strength of the body. So normally traditional physical therapy doesn't have an effective result. Traditional chiropractic care normally just tries to mobilize the spine to help make it more rollable, so help take some pressure off some nerves, but since it's not reducing the size of curve, it has a temporary result. Typically, just exercise therapy or types of exercises like that typically have limited results because they're normally with overall strength and symmetry. Scoliosis-specific therapy, scoliosis-specific chiropractic care, scoliosis-specific exercises are asymmetrical in nature, designing a structural approach, meaning these types of programs are trying to change the shape of the spine, and they're structurally based to help reduce the size of curve. If we don't reduce the size of curve and we're just treating the symptoms, these types of results tend to be temporarily. And the last thing is that we can augment all these types of therapies and exercises in rehab with something called corrective bracing to help reduce the size of curve when you apply this brace to push the spine into a more corrective position. If all these things are done appropriately and very successfully in a very comprehensive manner, we can combine all of that and also add some home therapy, home rehab, and home exercise to help stabilize the spine to actually achieve curve reduction and a more long-lasting improvement to the symptoms and pain that you're experiencing. Other than actually reducing the size of curve, what are some other things that adult patients help to do for pain that they feel with scoliosis? Well, we know scoliosis-specific care is by far the most effective, but however, just staying flexible, meaning doing basic stretching, basic muscle exercises, staying fit with your muscles and tissues can have a positive effect, because we know as curves become bigger, muscles tend to lose leverage in holding the spine and body into an upright position. As they lose leverage, they tend to stretch out these tissues, and it tends to cause more and more problems. So keeping your body fit and mobile is something that we always recommend. In addition, we also know as curves become bigger and they become more painful, they become more stiff. And as curves become more stiff, they can tend to cause more pain. So flexibility exercises of the spine can also be effective. However, both these things typically should be cleared by a provider or somebody who focuses on scoliosis, because the problem is no two curves are the same, meaning we can have left curves, we can have right curves, we can have lumbar curves, we can have thoracolumbar curves, we can have thoracic curves, we can have S curves, and one exercise may be effective for one person, may not be effective for you. So unfortunately, there's no one exercise I can say do this, but generally staying healthy and fit tends to be a positive effect. Generally staying flexible within the spine tends to have a positive effect. And of course, like I mentioned, doing over-the-counter medication, prescription medications, those can provide short-term pain relief, but by far the best way in dealing with pain in scoliosis is to reduce the size of curve. Curve reduction and sustained curve reduction by all means will typically lead to the best pain results and pain reductions that you're going to experience as a result of your scoliosis, because you're addressing what's actually causing it. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.